Welcome to Healthcare Authority's webinar sharing eligibility updates for Washington Apple Health Medicaid coverage and changes coming under Healthplanfinder Release 3.2 in mid-July. Topics we'll be covering in this presentation are Medical Assistance Unit changes, income collection and counting, scenarios, pending Washington Apple Health results for post-eligibility reviews, and other Healthplanfinder changes. While this is subject to change, Go Live for Release 3.2 is scheduled for July 17th. You'll notice changes when you log into Healthplanfinder on July 18th. Let's begin today's presentation by discussing the rules for medical assistance units, also referred to as MAUs or household composition, that changed in April 2016 for Washington Apple Health. We'll refer to medical assistance units as MAUs throughout our webinar today. Healthplanfinder System Release 3.2 in July supports most of these MAU changes. In the next few slides, we will further review the specific changes and share scenarios. A medical assistance unit, or MAU, is the group of individuals who must be included in an applicant or recipient's determination for Washington Apple Health. This may include people residing outside the home. If an individual is included in the MAU, their countable income is also included. It's important to note that individuals in the same household may have different eligibility results from one another. Spouses who reside together are always included in each other's MAU. For a tax filer, their MAU includes themselves, their spouse, and all tax dependents they claim. It no longer includes other children in the home who are under age 19 who they do not claim as a tax dependent. For a tax dependent who is claimed by a parent or spouse, their MAU is themselves, the tax filer who claims them, the tax filer's spouse, and all other tax dependents. For a person who doesn't file taxes, or for a tax dependent claimed by someone who isn't their parent or spouse, their MAU includes the non-filer, their spouse, and their parents, children, and siblings when living together. MAUs are based on tax filing status, relationship, and age. A tax filing category must first be determined for each individual applying for coverage. Some tax dependents are considered non-filers when determining eligibility for Washington Apple Health. Each individual will fall into one of three tax filing categories as explained in the next 4 slides. A person's tax filing status is what the person expects their status will be when tax time arrives. If a person is not sure what their tax filing status will be, they are considered a non-filer. Always update Healthplanfinder with what the person reports their tax filing status will be. For example, if an individual is a tax dependent claimed by their grandparent, they will be considered a non-filer. However, their tax filing status should be tax dependent of someone on or off the application. A tax filer is someone who expects to file a federal income tax return and not be claimed as a tax dependent by someone else. The MAU of a tax filer includes the tax filer, their spouse if living with them, and all individuals they expect to claim as a tax dependent even when the tax dependent does not live with the tax filer. It is important to note that if a tax filer is or expects to be claimed as a tax dependent of someone else, they do not fall under the tax filer status. They will either be a tax dependent or a non-filer as described in the next 3 slides. Also, please keep in mind the general MAU rules where a spouse is always included in the MAU with their spouse. A tax dependent is someone who expects to be claimed by a tax filer unless the tax dependent is neither the spouse or the child of the tax filer, is a child under age 19 who resides with both parents and those parents do not file a joint tax return, or expects to be claimed by a non-custodial parent. If the tax dependent meets any of these exceptions, they are treated as a non-filer as shared on the next slide. Common exceptions include a child living with their grandma and the grandma claims her grandchild as her tax dependent, a minor child living with his father and sibling, but the child is claimed by her mom who resides in another city, a minor child living with both parents who are unmarried. In those three examples, those children would be treated as non-filers. A non-filer is an individual who does not expect to file taxes, does not expect to be claimed as a tax dependent, or is an individual who meets the exceptions of a tax dependent as described in the previous slide. The MAU of a non-filer includes the non-filer, their spouse if living together, their children under age 19, and if the applicant is under age 19, their parents and siblings under age 19 who live in the same household. Every individual in the tax filing unit and household will be entered into one of the above statuses in the Health Plan Finder. These are broken out by the following types: tax filer, tax dependent, and non-filer. Select the tax filing status the individual reports in Health Plan Finder and do not enter a different status. Starting July 18th, Health Plan Finder will collect income and deductions for everyone on the application, regardless of age. There are no changes to the types of income and deductions collected and counted. For children under age 19 and tax dependents, their income is counted only when the income meets the tax filing threshold. If the income does not meet the IRS threshold that requires them to file a tax return, the income is not counted. Individuals claimed as a tax dependent in tax year 2015 had to file a tax return when earned income exceeded $6,300 for the year, or unearned income exceeded $1,000 for the year. The exception is if the unearned income is Social Security. Social Security of a child or tax dependent does not count. If the income of a child or tax dependent is entered into Health Plan Finder, even if it doesn't meet the tax filing threshold, and that child or tax dependent is in the MAU of an applicant, the income will count towards the eligibility for the applicant. One exception: when a child under 19 is applying for his or her own child, the minor parent's income counts towards the child. The updated language on the household income screen will indicate that individuals must report taxable income for individuals within their household of any age. The green hyperlink will navigate individuals to Health Benefit Exchange's Individual Application Support webpage. The application will continue to ask for income information for all individuals listed on the application, including questions on all types of employment and deductions. Now let's review several scenarios to show how the updated rules for medical assistance units and income affect eligibility for Apple Health. In scenario 1, Jason applies for himself, his wife Ashley, and their 2 children, Paul, age 8, and Emma, age 6. Jason and Ashley plan to file a joint tax return, claiming both their children as tax dependents. Jason is employed and has monthly earnings of $1,000. Ashley is also employed, earning $1,500 monthly. Paul and Emma report dividend income of $500 each. Jason and Ashley are tax filers, so tax filer rules apply to them. Paul and Emma are tax dependents for whom none of the exemptions listed under tax dependents apply, so tax dependent rules apply to them. The result is that for all 4 individuals, the MAU includes the tax filers and their 2 dependents. Since the income for Paul and Emma exceeds the tax filing threshold and is reported in Health Plan Finder, and they are included in other household members' MAUs, their income is included when determining everyone's eligibility for Washington Apple Health. The total household income of $3,500 monthly exceeds the income limit for Apple Health for adults. The total household income is below the Apple Health for Kids income limit, and the children are approved for coverage. For scenario number 2, we have the same situation as scenario 1, except this time no one expects to file taxes or be claimed as a tax dependent. Since no one is a tax filer or tax dependent, non-filer rules apply. Spouses, parents, and siblings for children under age 19 are considered for each individual. In scenarios 1 and 2, the same 4 family members are in each individual's MAU, regardless of whether tax filer or non-filer rules are used. Since the income for the children exceeds the tax filing threshold and must be reported in Healthplanfinder, and they're included in other household members' MAUs, their income is included when determining everyone's eligibility for Washington Apple Health. In scenario 3, Carol, age 60, applies for herself and her grandson Cody, age 12. She states that she will file taxes and claim her grandson as a tax dependent. Carol receives Social Security disability of $1,100 per month. Cody receives $600 monthly of per capita distributions from gaming. Since Carol is a tax filer, her MAU includes herself and her grandson, who is her tax dependent. When determining her eligibility, we count her income as well as Cody's income. Cody is a tax dependent who is claimed by a person who is not his parent or spouse. The non-filer rules apply to him and he has an MAU of 1. Only his income is counted when determining his eligibility. In scenario 4, Nick lives with his son Alex, age 14, his girlfriend Shari, and their daughter in common, Joan, age 1. Nick has monthly income of $1,200, while Alex has income of $600. He applies for himself and Alex. Nick does not expect to file taxes or be claimed as a tax dependent. This slide shares what Nick's application looks like in Healthplanfinder. Shari has income of $5,000 monthly. She applies for herself and Joan. Shari is a tax filer and plans to claim Joan and Alex as her tax dependents. This slide shares what Shari's application looks like in Healthplanfinder. Since Nick is a non-filer, his MAU includes himself and his 2 children. We count his and Alex's income towards Nick's eligibility. Nick is under the income limit and found eligible for Apple Health for adults as he has a household of 3. Shari is a tax filer, so her MAU includes herself and her 2 tax dependents. Her income and Alex's income counts towards her eligibility. Shari is over income and not eligible for coverage. Alex is a tax dependent who is claimed by Shari. Since Shari is not his parents, non-filer rules apply for Alex. His MAU includes his father and sibling, Joan. We include Nick and Alex's income when looking at his eligibility. Nick is found eligible for Apple Health for Kids. Joan is a tax dependent who is claimed by one parent but lives with both parents who are not married. Non-filer rules apply for Joan, so her MAU includes herself, both parents, and her sibling. Joan is not eligible for Washington Apple Health because after we take into account the income of Nick, Shari, and Alex, the countable income is over the income limit for Apple Health for Kids. In scenario 5, Sarah, age 19, applies for herself and her brother John, age 9. Sarah earns $3,000 monthly. She states that she is a tax filer and will claim John as a tax dependent. Sarah is pregnant and is expecting twins. John receives $200 monthly in Social Security, but it is not reported on the application as he will not be required to file a tax return. Since Sarah is a tax filer, her MAU includes herself, her brother, who is her tax dependent, and her 2 unborn children. Only she has countable income, so that is the income we count when determining her eligibility for Washington Apple Health. Sarah is under the income limit and found eligible for Apple Health for pregnant women. John is a tax dependent who is claimed by a person who is not his parent or spouse, therefore non-filer rules apply to him, and he has an MAU of 1. Since he has no income, he is eligible for Apple Health for Kids. In scenario 6, Jim and Jill are divorced with a child in common, Kyle, age 6, who lives with Jill but is claimed as a tax dependent by Jim. Jim has monthly earnings of $1,700. Jim, who lives in a different town, applies separately for himself. This slide shares what Jim's application looks like in Healthplanfinder. Jill is a tax filer and applies for herself and Kyle. Jill has monthly income of $1,600. This slide shares what her application looks like in Healthplanfinder. Even though Kyle does not live with Jim, he would still be included in Jim's MAU since he is claimed as a tax dependent. Since Kyle does not have income, only Jim's income is counted when determining Jim's eligibility for Washington Apple Health. Jim is found eligible for Apple Health for adults. Jill is also a tax filer, and she would include herself but not her son, as he is being claimed by Jim, who lives outside the home. Since she's the only person in her MAU, only her income is counted when determining her eligibility for Washington Apple Health. She is not eligible because her income exceeds the limit for one person. Kyle is a tax dependent who is claimed by a non-custodial parent, so non-filer rules apply to him. Under non-filer rules, an individual under age 19 includes his parents in his MAU if living with them. Kyle has no income, so only Jill's income is considered when determining Kyle's eligibility for Washington Apple Health. Kyle is found eligible for Apple Health for kids. Scenario 7 is the same situation as Scenario 6, but now Jill does not plan to file a tax return. This slide shares what Jill's application looks like in Healthplanfinder. The only change between Scenario 6 and Scenario 7 is to Jill's eligibility for Apple Health coverage. Since Jill is a non-filer and is not claimed by another person, non-filer rules apply. Under non-filer rules, we can now include her child Kyle in her MAU. She is now eligible for Washington Apple Health because her income of $1,600 is below the income limit for an MAU of 2. In Scenario 8, Natalia lives with her daughter Catalina, age 20, and Catalina's daughter Mia, age 1. Natalia has income of $2,000 monthly. Child Catalina has $800 in monthly earnings. Natalia files taxes and claims both her daughter Catalina and her granddaughter Mia. Natalia applies for herself and her daughter Catalina. This slide shares what Natalia's application looks like in Healthplanfinder. Catalina applies for her daughter Mia. This slide shares what her application looks like in Healthplanfinder. Since Natalia is a tax filer, we use tax filer rules. Her MAU includes herself and her 2 tax dependents, Catalina and Mia. We count the income of Natalia and Catalina when determining her eligibility. Natalia is not eligible for Washington Apple Health, as her and her daughter's income combined exceed the income limit for an MAU size of 3. Catalina is a tax dependent and doesn't meet any of the exceptions, so her MAU is exactly like the tax filer claiming her, Catalina, Natalia, and Mia. We count the income of Natalia and Catalina when determining her eligibility. Catalina is not eligible for Washington Apple Health, as her and her mother's income combined exceed the income limit for an MAU size of 3. Mia is a tax dependent claimed by Natalia. Since Natalia is not her parent or spouse, non-filer rules apply for Mia. Her MAU includes her mother, Catalina, and herself. We count only Catalina's income, and Mia is found eligible for Apple Health for Kids coverage. In Scenario 9, Carlos applies for himself, his spouse Sebastian, and their friend's child Anna, age 17, who they have guardianship over. Carlos and Sebastian file jointly and claim Anna and their son Rafael, age 21, who is away at college, as their tax dependents. Carlos has income of $400 monthly. Sebastian earns $1,900 per month. Anna, who is unrelated, has income of $500 monthly. This slide shares what Carlos's application looks like in Healthplanfinder. Because Rafael is age 19 or older, he must apply on his own. However, his application data mirrors that of his parents. Rafael has no income. This slide shares what Rafael's application looks like in Healthplanfinder. Carlos and Sebastian are tax filers, claiming Rafael and Anna as tax dependents, so their MAUs would include themselves, their spouse, and both dependents. Since everyone is in their MAUs, all income is counted. The combined income of the MAU members exceeds the income limit for Washington Apple Health. Carlos and Sebastian are not eligible for coverage. Rafael is away at college and his parents expect to claim him. He is a tax dependent and doesn't meet any of the exceptions, so his MAU is the same as the tax filer claiming him, Rafael, his parents, and Anna. Again, the combined income of the MAU members exceeds the income limit for Washington Apple Health. Rafael is not eligible for coverage. For Anna, the non-filer rules apply since she is being claimed by someone other than a spouse or parent. Anna's MAU would only include herself and her income of $500. She is eligible for Apple Health for Kids coverage. In scenario 10, Amina expects to file taxes and claim her son, Ali, 10, and her father, Idris, 60, as her tax dependents. Her daughter, Fatima, 12, is claimed by her father, who lives in another state. Idris is not applying for coverage. Amina has monthly income of $1,450. Her father, Idris, has income of $550 monthly. Her child, Fatima, receives $450 in interest income per month. Amina is a tax filer, so her MAU is herself and her tax dependents, Ali and Idris. Their total income is $2,000, Amina and Idris's earnings. Amina's countable household income is under the limit. Amina is eligible for Apple Health for Adults coverage. Since Ali is claimed as a tax dependent by his parent, Ali's MAU mirrors the tax filer claiming him. His MAU includes himself, his mother Amina, and his grandfather Idris. The total income is $2,000, so he is found eligible for Apple Health for Kids. Since Fatima is claimed as a tax dependent of someone outside the home, she is treated as a non-filer. Her MAU is herself, her brother Ali, and their mother Amina. We count the income of Amina and Fatima only, which is $1,900. Fatima is eligible for Apple Health for Kids. Now let's review pending results for Washington Apple Health. Starting July 18th, individuals who reapply after being terminated from Washington Apple Health following a post-eligibility result may receive a pending Washington Apple Health result when reapplying. The eligibility results screen will explain whose eligibility was pended and why. A letter will also be mailed explaining the result and required verification. Both the screen and letter will explain what the individual needs to provide. Individuals have 15 days to respond. If verification is not received, Washington Apple Health will be denied. For Washington Apple Health, this will gradually replace the quality assurance flag in Healthplanfinder. Once the individual provides the information, eligibility staff at the healthcare authority will review the verification and complete the application process. If an individual previously went through the post-eligibility review process and did not respond to a request for verification, or the verification showed they were not eligible for Washington Apple Health, they will be flagged. Once they reapply, the system automatically checks their income and citizenship and immigration status. If citizenship or immigration is verified or income is reasonably compatible, the individual will either be approved for Washington Apple Health or be denied because they do not qualify. If they are denied after providing verification, they will have the opportunity to shop for a qualified health plan if they are otherwise eligible. An individual has 15 days to respond. If verification is not received, Washington Apple Health will be denied. If verification is received, Healthcare Authority eligibility workers will verify eligibility and complete the application. The eligibility results screen will show what verification needs to be provided. Additionally, the individual will receive a letter explaining what verification to provide. The verification can be submitted to the healthcare authority by uploading it to the Healthplanfinder Action Center after logging into their account, by mail to P.O. Box 946, Olympia, Washington 98507, or by fax to 1-855-867-4467. Additionally, if no verification is received, the individual will not be able to purchase a qualified health plan with tax credits. If the individual needs more time, they need to call the healthcare authority to request an extension. After being denied, the individual has 30 days to provide verification for us to reconsider their eligibility. This slide shows what the eligibility results screen will look like for an individual who receives a pending result. If an individual receives a pending Washington Apple Health eligibility result, the eligibility results screen will display the reason for the result. The screen will also explain what verification is required. The individual also has the opportunity to upload the requested verification. Correspondence will be mailed explaining what verification is needed. We will now highlight 3 examples of individuals who may be subject to a pending Washington Apple Health result. Heather was terminated from Washington Apple Health last year because she did not respond to a post-eligibility review and was flagged. She reapplies and attests to $1,000 a month in income. Her attestation cannot be verified through state and federal databases, so her Washington Apple Health is pended. She is sent a letter requesting proof of income, but does not respond by the due date and does not request an extension. Washington Apple Health is denied for not responding. In example 2, Jeremy's Washington Apple Health ended several months ago for not providing verification of his immigration status. He reapplies and receives a pending Washington Apple Health decision because his immigration status still cannot be automatically verified. He uploads proof of his immigration status, and healthcare authority reviews his eligibility. He is not eligible for Washington Apple Health as he has not met his 5-year bar, so Washington Apple Health is denied. He is now eligible to purchase a qualified health plan. In example 3, Joy and her son Raymond were terminated from Washington Apple Health 3 months ago for not verifying their income. She reapplies on December 7th and attests to $2,000 a month in income. The income is now reasonably compatible with available data sources. However, she is denied Washington Apple Health because she is over income and purchases a qualified health plan. Raymond is approved for Washington Apple Health because his mom's income was automatically verified and is found under the income limit for Washington Apple Health for kids. Now let's review the other changes coming to Healthplanfinder with Release 3.2. There are other changes coming to the Healthplanfinder with Release 3.2 that include enhancements to partial person ID match, application data collection changes for non-applying application members, income for all regardless of age, federal tax information consent, automatic broker-navigator partnerships, dental for qualified health plans coming in fall of 2016. There are enhancements to the partial person ID match. First, let's review what a person ID is. Washington Healthplanfinder stores a variety of unique identifiers of individuals, including demographic information, contact information, social security numbers, application IDs, and person IDs. A person ID is a numerical identifier stored in Washington Healthplanfinder that is associated with the unique combination of the first name, last name, date of birth, and social security number of every person listed on an application. The person ID follows the individual even if they move between different applications. For those familiar with ACEs client IDs, a person ID is different from an ACEs client ID. Note that while every application has an application ID, every individual on that application has their own person ID. Today, when adding an individual to an application, entering demographic information may match them to an existing individual within the system. While this process will stay the same, more triggers are being added to identify more partial person ID matches. If all the demographic information is the same, the individual is matched up to the existing person ID and they are able to continue with the application. Partial person ID matches a person ID match will be triggered if there is a match in only the date of birth and last name or social security number. This will be triggered when the individual is creating a new application on the About You page or when adding an individual to an existing application on the Edit Household Member page. This match may be correct, and the individual who is being added to the application already exists in Washington Healthplanfinder. This match may also not be incorrect, as there is often overlapping demographic information. For example, it is very common for someone to share a last name and a date of birth, two different Mr. Smiths born on 1/1/1950. The account worker must decide whether the match is correct or not and move forward accordingly. This is often where an error can occur. An account worker can confirm a person ID match when it is actually incorrect. This often happens because in the current state, the account worker is not presented with enough detailed information to make an informed decision. Partial matching will be modified to be more robust and account for the identified duplications of matches on Social Security numbers, first name, last name, and date of birth. This will increase the number of partial matches being triggered by the system. Screen design and messaging will be enhanced for individuals if a partial match is detected. The impact of this enhancement will expand the number of partial matches identified with the end goal of preventing multiple people from sharing the same Social Security number. There are several situations which will cause a person to receive a partial match. But first, let's review what a fuzzy match is. A fuzzy match is when there is a similar but not exact spelling of a name. For instance, John and Jon is considered a fuzzy match. O'Malley without an apostrophe and O'Malley with an apostrophe are also fuzzy matches. A partial match occurs when there is a match on first name and date of birth, a fuzzy match on last name, and no Social Security number provided. There is a match on first name, last name, and date of birth, but no match on Social Security number. There is a match on last name and date of birth, a fuzzy match on first name, and no Social Security number. There is a match on first name and date of birth, a fuzzy match on last name, and no match on Social Security number. There is a match on last name and date of birth, a fuzzy match on first name, and no match on Social Security number. There are a variety of common scenarios in which partial matches are triggered with Washington Healthplanfinder. For example, Harry gets married and wants to add Sally to his new application. Sally already had her own account previously. Joshua had an account a long time ago, but then disenrolled when his job offered insurance. When he loses his job, his wife wants to add him to her new application. Rebecca adopts Sandra and wants to add her to her existing application. Sandra already has a Washington Apple Health account. John Smith creates a new application but does not input a Social Security number. His birthday matches another John Smith. If the individual is trying to add someone to a new or existing application and they receive a partial match in Washington Healthplanfinder, they will be prompted to contact the HBE call center. This modal will appear if there is a partial match, and the individual will be prompted to contact the Health Benefit Exchange call center. The system will collect information related to citizenship, lawful presence, incarceration, and residency for individuals who are seeking coverage only. The following screens will be impacted: additional questions, additional screening, and application review. This will reduce the amount of data collection asked of people who are not seeking coverage. The individuals who are seeking coverage will be listed at the top of the page as required to answer the following questions. Any individual who is in the household who is not seeking coverage will not be listed in this introduction section. The additional screenings page will also be enhanced in a similar way for questions such as long-term care and emergency medical coverage. The one question on this page that is not impacted by this enhancement is the data collection on pregnancy. If yes is selected, the drop-down will provide a list of all individuals on the application, whether or not they are seeking coverage. The primary applicant will then select which individual is pregnant within the household, whether or not seeking coverage. There are several updates to the Federal Tax Information, or FTI, consent which occurs during e-sign. If the individual selects this box, Healthplanfinder will be able to retrieve federal tax information, and the individual will then be eligible for health insurance premium tax credits, or HIPTC. If the individual does not select this box, the individual will not be eligible for HIPTC. If consent is given from e-sign, then this consent is valid for 5 years and is recorded in the database. After 5 years, if another active consent isn't given, the box is rechecked and application submitted. The box will automatically uncheck and the individual will no longer receive health insurance premium tax credits. A manual correspondence will be sent out reminding individuals that they need to give active consent at the 5-year mark. A change does not have to be reported for the individual to go back in and recheck the box and then e-sign, but they do have to go through the renewal flow or change reporting. Another change in this release includes improvements to the partnerships for brokers and navigators and the individuals they assist. Brokers and navigators will now have an automated option to partner with an individual when creating an application on their behalf. This enhancement impacts all levels of brokers and navigators. This enhancement allows for a seamless partnership process when starting a new application from the Broker Navigator dashboard. Now let's review what this new partnership will look like. If the individual does not have a Broker Navigator, the confirmation to partner with a client page will display. This will happen when a Broker Navigator is creating an application on behalf of the individual from their account dashboard. This page will display after the About You page has been completed. This partnership page will not display for existing individuals who have already submitted an application and created an account. After the About You page, the Broker Navigator will be directed to the Confirm Broker Navigator page and be required to attest that the individual has provided consent for this partnership, agree to this partnership, designate whether they would like to receive copies of Healthplanfinder notifications sent to the prospective client, and additionally, the Broker Navigator will have the option to forego partnership and continue with the application creation on the confirmation page by clicking Proceed Without Partnering. If a broker or navigator assists an individual with their application who has already partnered with another broker or navigator in a different organization, the Confirm to Partner page will not display. Instead, the broker or navigator will receive a red message on the About You page stating the individual already has a partnership with a different organization. If a broker or navigator assists an individual with their application and the individual is already partnered with another broker or navigator from the same organization, they will not encounter the red message on the About You page. The broker or navigator from the same organization can proceed in assisting the individual with the application. There will be no prompt to partner if a partial ID match is triggered. The individual may either initiate the partnership or the broker navigator can partner with the individual after the application is submitted. If a partial match is detected, the broker navigator will not be directed to the Confirm Broker Navigator page. Instead, they must contact the Health Benefit Exchange call center for resolution. If a broker or navigator initiates an application for an individual from their dashboard and a full match is triggered on the About You page, the broker navigator must pass through ID proofing before moving forward to any other steps. If ID proofing is not passed, the broker navigator will be directed to contact the call center. Currently, the Navigator 1 role can apply for coverage on behalf of an individual and select plans for Washington Apple Health, qualified health plans, or health insurance premium tax credits. The Navigator 1 role was intended for navigators who assist Washington Apple Health clients only to select a plan. They will continue to be able to select Washington Apple Health plans for individuals. After this release, those with a Navigator 1 role will not be able to shop and enroll individuals in a qualified health plan or health insurance premium tax credits plan. Navigators roles 2, 3, and 4 will still be able to enroll individuals in both QHP and HIPTC, as well as Washington Apple Health plans. The 30-day partnership begins when the partnership is confirmed by the navigator in a Role 1. While the partnership is terminated after 30 calendar days, the navigator can search and re-partner for Washington Apple Health and Qualified Health Plan Health Insurance Premium Tax Credit clients. If the Navigator 1 role reports a change for the client and their eligibility status changes, the ability of the navigator to shop and enroll their client in a plan will be determined based on the new eligibility status of the client. For a mixed household, the Navigator 1 will be able to enroll in Washington Apple Health plans on behalf of those with Washington Apple Health eligibility. After Washington Apple Health Explore Your Options selection, they will be able to see the QHP Explore Your Options, but all the Add to Cart buttons will not be available for them to select a plan. With the new My Cart functionality that is coming as part of Family Dental, they will still be able to navigate away from the Qualified Health Plan Explore Your Options page by going to the My Cart page and check out. The Navigator 1 role will only be active for 30 days after the partnership is confirmed and will then be terminated automatically. During this period, the navigator will be able to shop for Washington Apple Health plans for the household. The client or Navigator 1 may re-partner, but it will continue only for another 30-day window. The partnership will remain for another 30 days and then be ended automatically following the 30-day window. The navigator can continue to re-partner after each 30-day period to continue to partnership. Once the partnership has been terminated, before or after the end of the 30-day period, the navigator will be able to search for clients with whom their partnership is terminated. Search functionality for this access level is new. On the Add Client screen, the Navigator 1 will enter the individual's first name, last name, and date of birth and click Next. Clients with whom their partnership is terminated will be returned in the search results, and the navigator will be able to re-partner with them. Individuals enrolled in a Qualified Health Plan, or QHP, will have the ability to enroll in Qualified Dental Plans, or QDP, for their families and/or themselves. New browsing features will be added to the Explore Your Options page. A shopping cart experience is changing the way individuals check out. The renewal and disenrollment process has been adjusted to account for QDP enrollment. The addition of qualified dental plans do not affect Washington Apple Health, as it already covers dental for most individuals. Individuals active on Washington Apple Health will not be able to shop for a QDP and do not have to take action to get or keep the dental coverage. Although the system changes to purchase a qualified dental plan are included in Release 3.2, the plans will not be viewable until November 1, 2016. More information will come before open enrollment. Today's session has been recorded and will be posted along with the slide deck to the HCA Stakeholder Training and Education webpage listed at the top of this slide around July 15th. Thank you for joining us to learn about eligibility changes to Washington Apple Health and the Healthplanfinder Release 3.2 system updates coming on July 17th.